Time to go inside your health. Naloxone or Narcan is a medication that can quickly reverse the effects of an opioid overdose. Last month, the first over-the-counter naloxone product started being sold directly to shoppers in places like drugstores, grocery stores, online. But a new Yahoo poll shows more than 80% of people who've heard of this potentially life-saving medication have little or no interest in buying it or having it on hand in case of an emergency. Our medical expert, Dr. Arkel Giorgio, is here now to take a deeper dive into this topic. I got to tell you, I had no intention of buying it. I guess I didn't really think it was something I needed. But let's talk a little bit more about what this product is and why more people should reconsider.
Sure. So most people who have heard of naloxone think of it as an intramuscular, intravenous type of medication given by medical professionals. And now this is the nasal version. And I just want to say that whether you get the other version in an emergency room or by a paramedic or you use the intranasal, it is just as effective, but much more safe for a non-medical person to administer. Because either way, it's the same medication. And the way that it works, Leah, is that when somebody is taking an opioid, those opioids attach to receptors in the brain that are attached to your breathing centers in your brain. So when too many of those receptors are filled, you stop breathing. That's how people die. What naloxone does is it has a stronger attachment to the receptors, kicks out the opioid and attaches to the receptor and doesn't affect the way that your breathing center operates. And so I think it's really a step forward to have this available over the counter and in nasal form.
Okay, so you don't need a prescription, it's over the counter. How do you use the nasal version then if you're using it on someone else?
Right, and you would typically have to use it on someone else because that person is overdosed. Right. So the way to use one of those nasal sprays, if you've ever used any nasal spray, it's not particularly different than that. The person has to be lying back, you tilt their head back, you see this great video put out by the CDC. And as you watch that, something that I do want to point out if you do administer this on someone is that if their passing out is not due to an opioid overdose, but you give this medication, nothing bad is going to happen. Only something good can happen if you're right and it was an opioid. But if it was something else, maybe it was Valium, this won't work, but it won't hurt them. So I really want to point that out.
I think that is important for people to understand that part. You were surprised when you saw the poll, that Yahoo poll, saying that even people who are aware that this is available to them are not interested in buying it. I said, I guess I'd never considered purchasing this. What do people need to know? Why is it so important for just everyone to have?
Well, and we're going to get there as a society, but it is pretty new. The first thing, which is a minor reason why people aren't buying it or considering buying it, is the price. So it's about $45 for 2 doses. That's a lot of money. But the bigger reason, the bigger reason is people think, well, I don't need that. I'm not a drug addict. Clearly, this is opioid users, abusers are the ones who are at greatest risk and who this would benefit most from. But when we think about it, any household that has anyone in it that has any opioids, maybe it's a grandparent that has chronic pain, maybe it's a cancer patient, there's children in the home, there's other adults in the home, any household that has someone that has opioids in it, even if they're prescribed, should consider having this in their first aid kit.
All right, we'll see if more people decide to pick it up.
I hope so.
Thank you.
Take care.